What's the context? The Programme for Government outlines the overall direction for reform of our health system, but the particular focus to this work was the Section 10 letter from the Minister outlining to the previous chair of the HSE how these groups would come into existence. And in the first instance, these are transitional groups. These are on a non-statutory basis, and the agenda is that over the next 2 years they will evolve, subsequent to legislation, into independent hospital, we call them trusts, and that initial process was given a foundation by that Section 10 letter. The project team and the strategic board came into existence in June 2012. What's the rationale for this review? We have a relatively large number of hospitals for our population who range in size and form and scope and have evolved over time. You can't see, when you meet all the hospitals as we have, what the overarching plan was. It's been a haphazard process over many years. And that has led to duplication, fragmentation of resource, and it is now amplifying or magnifying the difficulties we have with recruitment and retention of key staff. And indeed, when you look at the application of public resources, it's hard to explain some of the inequities in terms of resource distribution across our system. So what is the vision we outline? What we hope to see are 6 substantial, sustainable hospital groups. These are linked to a primary academic partner, so that the culture of these groups is open to teaching, learning, research, innovation. They are primed and ready for change. And the one thing you can be sure of in the hospital system, if you work in it, is that change is inevitable. We think that that will lead to a higher quality service with more consistent standards of care. If you have a standard procedure in the smallest, most distant hospital in the country, it should be done to the same quality standard as in our biggest teaching hospital in Dublin. And that requires us to change how we've organised and run our hospital system. And it does also require greater integration, overt integration, between the delivery of healthcare and the teaching, training, research and innovation agenda. I would add also that healthcare is something that we excel at in terms of making a contribution to our own economy. Half of our exports are in this area, and we have to have a healthcare system that at least is welcoming and facilitatory for that vital part of our economy. But it all primarily is about patients, and the benefit to patients are that we would look to have a safer, higher quality healthcare system with strong, profound clinician leadership embedded within that system. It must be a system that allows for integrated care pathways and still protects what is a cornerstone of the Irish healthcare system, that is patient choice. So regardless of the form and shape of the groups, patients will still retain the choice of where they seek care.